Hello, my name is Lillian Agbegbe and this is Ellie Lenses. Happy New Year to you. I'm glad we made it into 2018 and today I want to talk to you about staying alive. Staying alive and making it into 2019 and beyond. I know what you're saying. We only just made it into 2018. Do I want to give us some time to settle in 2018 before talking about 2019 and beyond? No. This is a very important conversation, and I couldn't think about a better time to have the conversation than to have it right now. Now, in order to have this conversation about staying alive, I'm going to go to a sad place to be able to set the context for us using my own personal life. 2017 was a very difficult year for me, particularly the second half of the year. And one of the reasons why it was very difficult was things I had to deal with in terms of bereavement. So starting from July 1st, it was the first anniversary of my brother-in-law passing away, and he had passed away the previous year from stomach cancer. July 19th, my sister-in-law, my brother, and the kids were having a conversation. My sister-in-law went to use the restroom. She didn't come back. By the time they went back to get her, she had passed out. They rushed her to the hospital and she was declared dead on arrival. She had been managing high blood pressure. November 25th, my cousin went out, came back, drove himself home, got into bed, slept, and on Saturday morning, he was gone. Now, there was talk about undiagnosed sleep apnea. And like about 10 days later on, a cousin of mine had gone from the town where he stays in Warri to Lagos to conduct some business and took ill, and before we could say anything, he was gone. There's talk about poorly managed diabetes. Now, except for my brother-in-law, my first brother-in-law who died with cancer, these are the people who passed away in Nigeria. And I know that we are often quick to talk about Nigerians poorly managing their health. I want to bring us to December 12th, 2017 here in the US. And San Francisco Mayor Edwin Lee was out grocery shopping with his wife when he collapsed and he died. Now, Mayor Lee had been mayor of San Francisco for a long time, since 2011, I believe. And it's very likely that he not only had health insurance, but he was using his health insurance. And despite that fact, he still dropped dead as he were. So what am I trying to talk to us today about staying alive? I think that as much as I'm not naive to think that we are going to live forever, I think that death is an inevitable part of living, and we are bound to die at some point or the other. But I wanted to talk to us about you playing a part, making some definite changes that are doable in your life, about contributing to you staying alive up to 2019 and beyond. And there are 4 things I would like to talk to us about today. Number 1, quit smoking. If you are smoking, you need to quit smoking. Smoking is the leading cause for lung cancer. If you smoke, you're 15 to 30 times more likely to develop lung cancer than someone who doesn't smoke. And if you live in the United States, it's very easy, as it were, for you to stop smoking. The smoking cessation programs are all over the place. Contact your local public health department. Better still, get on your computer right now and Google smoking cessation, and I bet you will find a program near you that you can contact and they can help you to stop smoking. If you do not live in the United States, I do not know what resources are available to you in terms of smoking cessation programs, but I want to share with you some non-conventional things that people have shared with me about how they have stopped smoking. One of them was a friend of mine a couple of years ago, and he said his driver came to ask him for a loan. And he looked at how much the driver wanted to loan him, I think to pay for school fees, to do something significant in the driver's life, as it were. And he looked at that amount of money, and it was actually the amount of money he spends every month on cigarettes. And he said to himself, Are you telling me that the amount of money I spend on cigarette every month is something that makes a significant difference in the life of some other person? And that was his motivation. That was how he stopped smoking. So I say to you, look for some motivation, something that can spur you on. My other friend had gone to see the doctor, had some health condition, and the doctor showed him an x-ray of his lungs. Remember, smoking is a risk factor for lung cancer, right? And the doctor showed him the x-ray of his lungs, and the doctor showed him the x-ray of a non-smoker, how your lungs look like if you don't smoke, and how his lungs look like he had been smoking for a while. And for him, it was just clear that he was heading down a bad road. And that was his motivation, and he stopped smoking. My girlfriend tells me about when she had her baby, her first baby girl, and she was in the hospital, and they brought the adorable baby girl to her, and she put the baby in her arm, took one look at the child, and knew in her heart that she wanted to give this child the best life possible. And there and then, she knew that smoking around the child wasn't part of the best life possible that she could give to the child. She went out, smoked one last cigarette, and that was it. And that was it. She never smoked another cigarette again. And yes, secondhand smoking is a risk factor for lung cancer. In fact, studies are ongoing about the risk of third-hand smoking on lung cancer. So not only do you risk your own life when you smoke, you risk the life of your loved ones, your children, your family members, and your friends when you smoke around them. I really want you to look and explore avenues for you to stop smoking. The second thing I'd like to talk to us today is about diet. Now, this wasn't one that came easy to me, so I understand that's not one that comes easy to people. And I'm going to tell you something I used to do a while back. So if you invited me to a birthday party, chances are if I didn't trust you, I was going to show up with a birthday cake and a tub of ice cream. And no, it had nothing to do with how much I felt about the person having the birthday party. It was, I just used to think I would die if I went to a birthday party and I didn't have cake and ice cream. No. I would die if I continued to have cake and ice cream at the rate at which I was going. And I was doing this. I had even transferred it to my daughter. She goes to birthday parties and she doesn't see cake and ice cream. She thinks something is wrong with the people. And that went on until my doctor said to me, hello, we're already managing high blood pressure and something is going on with your cholesterol. And you need to do something. You need to have some lifestyle changes. And so guess what? These days I go to birthday parties. I see cake, I see ice cream. It doesn't mean anything to me. So guess what? I know you may have struggled with this. You may have been thinking, how does this work? But I tell you, you can eat smaller portions of food. You can eat healthier. You can go on fruits and vegetables. You can read the food labels when you're buying things in the store. You can become very conscious of the things that you eat. Talk to a nutritionist. Go online and find the nutrition, healthy recipes. And you can grill, you can bake instead of frying. I used to love fried plantain, like, there's no tomorrow. But, substitute vegetable oil. There's so many simple and easy things that you can do to modify your diet and so that you can live a healthier life. And the third thing I want to talk to us today is about exercise. Exercise, exercise, exercise. Yes. And guess what? Today you're on the internet. I tell you, I downloaded an app on my phone the other day, 7-minute exercise. I did 7 minutes of exercise, and in my house, in my room, 7 minutes of exercise, I was sweating, my limbs were so sore. I was like, oh my goodness. So that's very possible. You can go to YouTube. There are lots of free apps you can download on your phone. There are a lot of exercise trainings that you can download from YouTube, and you can get in shape. And if you're the sort of person who's not self-motivated, you need company, you need a trainer, by all means, go to the gym, get a working body, do something. But don't continue to live a sedentary lifestyle. Don't continue to sit down and do nothing. And here's the beauty about diet and exercise. They are a risk factor for so many health conditions. So when you get those under your belt, you're actually killing many birds with those two stones. You're improving your choices of better health, your health outcomes on so many platforms by addressing the issues of diet and exercise. Lastly, I want to talk to you about having your annual physical checkup. I know I said that Mayor Lee had health insurance, was probably getting his annual physical checkup, and he still died. But when you look at the risk of not getting it at all and having a negative outcome is way higher than if you get it done. What happens when you do your annual checkup is what we get opportunities to do things like primary prevention, secondary prevention, and tertiary prevention. We can stop you from getting a health condition. Like they said to me, this isn't working well, and you can get some recommendations. Begin to exercise, begin to modify your diet so that you do not develop this negative health outcome. And even if you do have breast cancer or colon cancer or something, if you go for your annual screening and it's detected early, you can get into care and something can be done about that health condition, or something can be done to make sure that you're able to live longer. It was one of the most remarkable things that happened the other day. If you look at the 10 leading causes of death, which I did, I was surprised to find out that those things that are leading causes of death, heart disease, lung cancer, breast cancer, COPD, unintentional injuries, people survive from the same things. People survive from the same things. And what makes the difference between whether you're going to die or whether you're going to survive is whether you get into care on time. And so that's why your annual physical checkup is extremely very important. Now I want to tell you, I know it's January and you're thinking, I'm not talking about a New Year's resolution. I'm not talking about something for you to do for 2 days or 2 weeks. I'm talking about a lifestyle change. I want you to think about incorporating these things into your life so that you can be here for 2019 and be here beyond 2019. I want you to think about playing an active role in you staying alive. My name is Lillian Agbegbe. I'm Executive Director of The Rest of Our Life. You can reach me by email, therestofourlife, one word, @gmail.com. You can send me your questions, your comments. You can follow us on Twitter. We are on Facebook. I look forward to hearing from you, and I look forward to speaking to you next time. But before I go, I want to remind you that I would like you to make deliberate efforts to quit smoking this year, to improve your diet, what you eat, do some form of exercise, and make sure you're checking with your doctor to make sure that you're doing all that you can do to stay alive. Thank you for listening, and I look forward to being with you some other time. Bye.